Jadi baik preeklampsi maupun itu sampai menurunkan kejadiannya sekitar
62 and also published more than 100 books. So without further ado, welcome you to our department, and please you can start.
Okay, thank you. Good morning. Thank you very much for your nice presentation. It's a big pleasure for me to be here and to meet some old-standing friends. I've been in Indonesia many times. Beautiful country. But you see, this is a Perugia opportunity to have a university. And this was 1307, so many years ago. Okay? And then the other is a logo of my international school. Some of you have been attended, been coming to Florence. Should be mainly sunflower more than soybean, because the release of progesterone is much higher. So for instance, some of the compounds which are coming from countries which they use soybean, like China, is not as the same as produced by company. The assumption is not substantiated because placenta takes 2 months and a half to be formed. Placenta starts to be formed around 7 to 8 weeks and is completed around 18, not before. If you think of all the modification the placenta needs to do, vascularization, new vessel and so on, it doesn't stop after 2 or 3 weeks. And it does mean that progesterone is not useful. Because, okay, you can support the luteal phase, but then you have the problem of the risk of abortion, because the placenta is not properly formed. Next. So, you see, if you stop at the pregnancy test, you lose a lot of pregnancy, so don't stop. Okay, next. So the people have a paradigm about miscarriage of preterm birth. Pregnancy is a continuum. So why I have to classify pregnancy as a, ending as a miscarriage or ending as a preterm birth? The real difference is given, let's stop a moment, is given by the fact that I consider the viability of a fetus after a certain gestational age. And this viability of a fetus, according to the consensus of WHO, is around 22 weeks, 22 gestational age. Okay? But think as a unified concept. Okay? Next. This is a very important paper I want to show you. This is a paper of Liggins in New Zealand, which demonstrates corticosteroid given to a preterm delivery, before preterm delivery, can prevent mortality and RDS. You know about this? No, you use corticosteroids, correct?
And also a recommendation for obese pregnant women, whether this is more beneficial, and also is there any different dose for fitness for the obese pregnant woman? And the second one is for Professor Bowo. In your lecture, you've given explanation.
Because progesterone also reduce the ciliary beads, so is there an impact on that? And second is, we have a specific patient selection for that in the patients who we give in natural cycles in the early luteal phase, because usually we check the progesterone in the middle.
In implantation failure, there is no definition about that. And also, in our case, there's maybe some patients have experience spotting, and then how we adjust the dosage. And as you mentioned also,